Good morning. So today we'll discuss on the topic on health education. I am Dr. Tehilin from Department of Public Health Industry, PMS Dental College. Education is the most powerful weapon which you can use to change the world. This is given by Nelson Mandela. Today's topic is on principles of health education. These are my contents. So education is derived from the Latin word educare and educure, which means to bring out and to lead. So health education is a process of imparting information about the health in such a way that the recipient is motivated to use that information for the protection or advancement of his own, his family or his community's health. So education is a process that inform, motivate and help people to adopt and maintain healthy practices and lifestyle. Advocates environment change as needed to facilitate this goal and conduct professional training and research to the same end. This is given by National Conference on Preventive Medicine in USA. The primary objective of the health education is to inform people, motivate people and guide the people into action, and this is the final goal. There are 12 principles of health education: credibility, interest, participation, motivation, comprehension, reinforcement, learning by doing, known to unknown, setting an example, good human relationship, feedback and community leaders. First principle is the credibility. So credibility is nothing but the truthfulness. That is the degree to which the message which you are telling or you are conveying to your population should be trustworthy. And it should be consistent. That is, you should tell the same thing again and again. It should be consistent and compatible with the scientific knowledge and also with the local culture. Otherwise, no desired action will ensure. So, the problem with this is that credibility plays an important role in health education. Otherwise, if the word or the action which you do is not credible, then the desired outcome is not achieved, will not be achieved. Next principle is interest. The interest is whatever health information or health education which you are providing to the people, it should be the topic of interest to the people. Then only people listen. If your interest should be, if your interest is not the interest of the people, then they will never listen and it is waste of time. So whatever topics which we are giving to the patient or population, it should be apt to that situation. For example, in a place where there is spread of COVID, and giving health information or health education about smoking and alcohol is not appropriate for that time. So in that case, giving COVID health education about the whole COVID prevention and how to take care, that will be an appropriate thing to do. So that is called interest in principles of health education. That is the felt need of the population. Next comes the participation. Even though we are providing information which is credible and we are creating an interest among the population, there is an important thing is called participation, which encourages the people to participate in the program. So it can be a panel discussion or a group discussion. Next comes the motivation. Even though you create an interest among the population, you should motivate them to make a change in their lifestyle. So for example, you are treating an adolescent patient and you are explaining about your gum example. You will get gum problems if you don't properly do scaling or if you don't put orthobraces. So in that case, telling the way of telling and motivating them is important, because in adolescent they consider aesthetic and smile as a very important factor. So in that scenario, you can encourage them telling that your smile and your appearance will be improved when you do scaling or ortho treatment. That will be an appropriate thing, rather than telling a generalized term that you will get gum problem, or like complaining or blaming them not for not doing a scaling or a ortho treatment. So that's what I told before only. Losing, for example, another one example is losing weight could make her feel more energetic, confident, or improve her appearance, things she personally values. So she may be more repetitive to advise and more likely to take action. So motivating through personal goal, like you have to exercise regularly, can help perform better in sports, have taken more energy during the day, and even help you sleep better at the night. So motivating in that way will enable them to improve their health. principle is comprehension. That is, know the crowd. That is, we have to know whom we are talking to. That is, if you are talking to a illiterate or a not very well educated poor people or population, then it's better always to avoid jargons. Normally, when you're talking, also you should not use a medical terminology to or some other terminology which they don't understand. So complicated term to avoid. It's always better to avoid complicated terminologies. Example: eat food items which are non-carcinogenic. So we don't know. Most of the people doesn't know what is carcinogenic food and what is non-carcinogenic food. So it is always better to tell the other way around. That is. Avoid food which are sweet and which sticks to your teeth like toffees and pastries. This is a better way to put your words. That's what comprehension is. That is, they have to understand what you're telling or what you're trying to impart on them. The next one is reinforcement. The reinforcement is nothing but repetition. Repetition needed in health education. It's kind of a booster dose. So Einstein once said that education is not of the learning of fact but the training of the minds to think. So always you have to train the participants of the population regarding the health or of whatever topics you are trying to impart. You have to repeat the thing again and again after a particular time period so that it will stay in their mind forever. Or else once if you are told and then you left like that, nothing is going to bring a change in the minds of the people. So that's called reinforcement principle. So before moving on next slide, it's very important to know what is positive and what is negative reinforcement. So one example I'll show you, that is, see, negative reinforcement is by you're telling, for example, in this picture they are showing that a person is a librarian, I guess. So he is telling that no yelling in the library. So the girl told, hey, found the books. So that's called negative. You are scolding and making them behave well. Similarly, positive reinforcement is nice using your quiet voice in the library. So I found your book. So that's what. So you're positively telling them that you're good. So that way they reflect you in your positive attitude. This depends upon the person to person. The negative wording focus attention on the unwanted behavior. Positive wording focus on attention on the desired behavior. So that's what the difference is. Next very important thing is learning by doing. So when we hear something or when we learn something, it's always by doing, not only just by hearing. When you hear something, you just read it, hear, understand, but provided until you learn or do something, you will never be able to, until you do or perform some actions, you will never be able to repeat it again. That's called learning by doing. So if I hear, I forget. If I see, I remember. This is one important quote in health education. If I do, I know. That's the learning by doing. So for example, brushing technique, if you're trying to impact the health education on brushing technique, that's the main thing. So one is that you're trying to tell them how to brush, how many times you have to brush, what is the angulation, etc. But all this is of no use if at all it is not demonstrated, and it is made, it's also available, provided you are making them also to do the same thing. Otherwise nothing is effective. Next is the known to unknown principle. The health educator has to start with the what people already know and then give the new knowledge. That is, you have to build on the existing knowledge. So for example, you will ask the patient or population about what they know already about oral health. Then from then on you can develop. So that is called known to unknown. Then is setting an example. So teaching and preaching is not effective until you set an example to them, until you follow them. So for example, you just give health education on no smoking, smoking causes cancer, etc. And the moment at some time 5 minutes of interval you go and smoke in front of them or behind the camera or whatever it is, it's no use to the patient or population whom you are trying to educate a lot. So that's what setting an example means. So a good example has twice the value of a good advice. That's given by Albert Einstein. Albert Schweitzer. Sorry, it's Albert Schweitzer. Next is good human relationship. The health educator should have a good personal quality and also should maintain the friendly relationship with the people. So while maintaining the friendly relationship, they'll be having a friendly approach towards us, and we'll also be comfortable. They'll also be comfortable to ask so many questions, doubts regarding whatever doubts they have. They'll ask. If you are very strong and stubborn to not answer any question, then there'll be no information gained, or they won't come and ask if they have any doubts. So you should be always friendly to them and in a good human relationship. Next is a feedback. It's very important for any program which you conduct, for any health education you conduct. It's always better to ask the feedback, that whether they understood what they are taught and how was the program, and if there is anything changed to be to make the program more effective. That also comes under feedback. And the last one is the community leaders. That is, leaders or agents of change, and they can be made use of in health education work. So, for example, in a place where there is panchayat kind of, or a small village area, most probably they listen to their leaders, their own leaders, community leaders, rather than a new person going and teaching them. So, always involve the community leaders in health education so that they'll get a confidence, or they'll get a credibility from due to the trust they have on their leaders, rather than a new person going and telling them. So that's called involving the community leaders. So these are the 12 principles of health education. So one more important factor you should be knowing is soil, seed and sower. Soil is a community where we sow the health education, and sower is a person giving the health information. And seed is the information which you are providing. So seed in a field of the agricultural field is compared to a community, and then the seed is compared to the information which you are giving the people, and soil is the community, and sower is the person who gives information. So that's called soil, seed and sower in health education. So to summary, there are 12 principles: credibility, interest, participation, motivation, comprehension, reinforcement, learning by doing, known to unknown, setting an example, good human relationship, feedback and community leaders. These are the 12 principles of health education. I hope you all understood what is the principles of health education. So to conclude, health education is a vital to practice of prevention. It is a channel for reaching the people and alerting them to health services and resources. The focus of health education is on people and their reaction through planning and teamwork. Its goal is to make realistic improvement in the basic quality of life. So these are my references. Thank you so much. Thank you.